According to my experience, there are two conditions that I will do the IOL explanation for without a doubt. Can you believe your eyes? A broken haptic is found just after injecting the foldable IOL. What's your next move? First, remove the haptic fragment. Then, trisect the IOL inside the anterior chamber into small pieces with a cutter and remove the pieces one by one. In this way, there's no need to enlarge the wound, which can still be kept as small as 2.2 millimeters. Avoid pulling or touching the iris, which may cause damage or tears to the iris. However, life isn't always the way we want it to be. Another case is an unhappy multifocal IOL patient on whom YAG laser capsulotomy was carried out. This patient had a cataract surgery 5 months earlier. He complained about severe glare and unsatisfactory visual quality. He was referred to me for a second opinion regarding IOL exchange. I was amazed the former surgeon had done a YAG capsulotomy so quickly, because once you create an opening in the posterior capsule, it becomes much more difficult and dangerous to exchange the lens. So, I'm going to replace a premium multifocal IOL with an Acrosoft monofocal IOL. A spatula is used to dissect IOL and anterior capsule through the side port and the incision wound. When I try to free one of the haptics, I notice that there's capsular fibrosis. It's risky to dislodge the haptic from the fibrosis. It will tear the capsule and injure the zonule. Now what I would like to do is to amputate the haptic from the haptic-optic junction. Once the haptic-optic junction is free, I recommend always inserting the new IOL under the old one before removing it. In this way you can secure the posterior capsule and prevent vitreous prolapse. Then, cut the optic carefully. Remove the pieces through the original incision one by one as mentioned before. Again, I'm wrestling with the haptic, and it's also difficult to release it. Therefore, I decide to amputate it. I would rather leave it in the bag than cause further damage. The patient is happy now, and the glare completely resolved with no sequelae. When you perform the IOL exchange, care must be taken to prevent further damage. Surely an alternate plan should be prepared in every intraocular lens exchange surgery.